So we are having a casual discussion about the advantages of organ-based surgical oncology. We're a team that has been practicing cancer surgery in an organ-based setting for more than 10 years now in the Delhi NCR region. My name is Vinay Samuel Gaikwad. On my right is Jyoti Bhatt. Next is Vineet Kaul and Mansi Chowhan on the far right. And we wanted to discuss amongst ourselves and with you why we decided to take up organ based surgery when it comes to cancer treatment and how it is benefiting our patients who are coming to us with cancer and how organ based or disease specific oncology is helping us to deal with these patients better. Let's start with Dr. Mansi, who is a breast cancer surgeon in our team.
In my opinion, when you focus on a particular organ, like in my case, breast cancer, so it helped me getting trained for the cutting edge surgical techniques used like oncoplastic breast surgery, and that helped me delivering the best or the world class surgical care to the patient, as well as getting better clinical outcomes in terms of oncology as well as aesthetically, and delivering better quality of life. So that was my take on
So does the patient feel better coming to a surgeon who's dealing only with breast cancer? Do they feel more comfortable about that?
They do really, because they feel that whatever it's a more holistic or a more comprehensive care which they receive, rather than a very generalized approach to the patient. So the discussion which happens, because there is a lot of research and updates happening in the field of oncology, and when you are focusing on one particular organ, you are actually updated about what is happening in the world, and you actually are discussing the points which are happening all around. So they feel that they have been tackled in a better way.
So Dr. Vineet, what is your experience like when dealing with head and neck cancers, and how do you think you can relate to patients more in offering them better treatment when it comes to head and neck surgery?
So, in my practice over the years, I feel that having an organ based approach makes you more outcome sensitive. Outcomes in the terms of organ preservation, reconstruction, and overall quality of life. And because you are sensitive to these parameters, the results are better, which is ultimately what any patient suffering from cancer is looking for. And once you explain to them that what the overall quality or the outcomes of these parameters you will offer to them post surgery, during that communication you gave me a lot of confidence with the patient, and ultimately it's better for both the patient and for the surgeon.
Great, that's useful insights. And coming to Dr. Jyoti, who's dealing with our gynecological cancer patients, how have you been dealing with patients, and how do you think that being dedicated to a particular specialty is helping your patients?
Regarding this organ-based approach, so we are every day seeing same type of patients, and it becomes for us convenient, and in fact I would say perfect for many such cases, and we are able to plan a tailor-made type of a treatment for the patient. And so every patient is a different thing, but we are able to make it in a way that is specific for that patient, and further it helps to us to make daily planning for the patient, like neoadjuvant treatments and organ preservation surgeries, which is a little more easy for us when we are doing the same type of cases every day.
That's true. So, like Dr. Jyoti said, when we deal with gastrointestinal and HPV cancers, we can focus precisely on robotic surgeries to help preserve organs, to help preserve, for example, the anal passage. We can help uh, uh, preserve certain organs like the pancreas, and we can also do supramajor surgeries with minimum morbidity because we're doing high volume surgeries like HIPEC, which is hyperthermic intraperitoneal chemotherapy, and PIPEC. So these type of dedicated interest in particular surgeries helps to decrease complications, helps to decrease morbidity, and therefore increases the quality of life of our patients. And we have seen that repeatedly, and the patient satisfaction levels definitely go up. So, a cancer surgeon is obviously the best person to go to, and if we can find an organ-based cancer-specific surgeon, that is also one of the ways to deal with cancer. And this is how we, as a team, are coaching cancer patients every day, and we're very satisfied with the way that we're able to really deal with the cancer patient's problem, including rehabilitation, nutrition, quality of life, and all of these things, because that is where we focus our entire efforts. So thank you all for listening on this video, and I hope this gives you a perspective of about how organ-specific oncology, especially in surgical oncology, is really the way forward. It's present, and more and more surgeons are adopting this way of treating cancer patients.